It looks like the vitamin D wars have begun. We live in a capitalistic culture, and let's face it, if half the things researchers are saying about vitamin D are true, and I believe they are, vitamin D will be the shining star in every company's nutrient line for a long time. That means competitors will position themselves to distinguish which product is better. It's a good thing to compare products and try to have the best one available for the patient. But let's remember that vitamin D will have a profound effect upon people's lives. One researcher said that we may be able to cut healthcare costs worldwide by 25% if we got people's blood levels to the 50 to 80 nanogram per milliliter level. Sometimes we get to be vitamin snobs looking for the best products. Best or better is a multidimensional word that carries a lot of subjectivity. Better absorption, better compliance, better effectiveness, better price, and finally better from a safety perspective. It's important for us as clinicians to know the story so when our patients come to us and say, I just heard on the radio that this form is better than the one that you're giving me, you can smile and tell them the whole story. But before I get to discriminating, which I guess is the professional word of, or professional way of saying picky, keep in mind, as long as it's vitamin D3 and we give them enough, we're golden. The buzz comes from an unpublished study which compares an emulsion form of vitamin D3 and a micellized form of vitamin D3. The claim is that a particular form of micellized vitamin D is 5 times more absorbable than emulsified forms of vitamin D. Whoa, that's a pretty strong statement to make. In a minute I'll get to another published study that refutes that claim. But let's look at a few details first. What is an emulsion? In nature, we know that the oils in seeds, nuts, and mother's milk are in an emulsified state. Once in that emulsified state, the oils can get into the lymph system where every cell in the body is bathed. But the greatest misunderstanding comes from the fact that all emulsions are not created equal. I can add olive oil to water, put it in a bottle, shake it up, and voila, I have by definition created an emulsion. However, it only takes seconds for the oil and water to separate because it's a very poor quality emulsion. Often emulsions will separate easily because of poor processing. Years ago, Biotics Research was fascinated by the German research on high-dose vitamin A and invested in the technology to create a consistent emulsified product that will not separate. I often put 5 or 6 drops of one of their emulsified products in a glass of water, stir and let it sit on a table for days to demonstrate. It will not separate. Depending on the manufacturing process, there are many sizes of emulsified products also. To assure that their vitamin A contained the smallest emulsion particle, Biotics went out and purchased all the available emulsified products on the professional market to check the particle sizes. You can see by the pictures that there's a big difference in particle size and consistency. The Biotics emulsion is consistent throughout the entire slide. This consistently small particle allows the emulsions to go directly into the lymph system where every cell is bathed. One of the concerns with nano-sized particles is that if they're too small, they can get into cellular areas that may not be prepared to handle large quantities of a concentrated substance. Biotics emulsions, however, hover right around that 1/2 micron mark. This means the emulsified particles are small enough to go directly into the lymph system, but not so small that they may create cellular disruption. The emulsification technology Biotics has utilized for over 30 years has proven safe and effective. Micellized products, on the other hand, are created by mixing oil with a detergent-like substance, which creates a nano-sized particle. This smaller than light-sized particle is invisible to the eye and goes directly into the bloodstream. This theoretically is a great way to raise blood levels. At this point, however, no one knows if these microparticles ever get into the lymph system and bathe outlying tissue. Yes, they increase blood levels, but do they raise them a factor of 5 over emulsified products? Let's compare the unpublished study that's causing so much controversy to a published study. The comparative study cited was conducted by a reputable lab that performs vitamin D testing. The unpublished study, often used with marketing graphs, claims to have compared to a emulsified vitamin D to a micellized vitamin D. The results of the unpublished study state the following. Patients used 3,000 international units per day of the micellized product for 60 days and achieved an average increase of 79.9% in the serum 25-hydroxy vitamin D. It's worth noting the lab that did the testing also sells the micellized product through their website. The product tested supplies 600 international units per drop. On the surface, that sounds pretty impressive. However, a clinical trial was conducted using Bio-D-Mulsion Forte by Biotics Research. The peer-reviewed results were published in 2008 by the Journal of Clinical Endocrinology and Metabolism, the world's leading peer-reviewed journal for endocrine clinical research and cutting-edge clinical practice reviews. Bio-D-Mulsion Forte by Biotics was dosed at 2,000 international units daily for 42 days and achieved an average increase of 202% in serum 25-hydroxy vitamin D levels. In a nutshell, comparing the unpublished data supporting the micellized vitamin D and peer-review published data, the micellized products used 50% higher daily dose, 3,000 international units versus 2,000 international units. The micellized product was taken for a significantly longer period of time, 60 days versus 42 days. Yet Bio-D-Mulsion Forte achieved a significantly superior result, 202% increase in serum 25-hydroxy vitamin D versus 79.9% increase using the micellized form of the vitamin D. This report supports clinical feedback that I've received for years that Bio-D-Mulsion increases blood levels when other forms do not, especially with treatment-resistant patients. We just discussed earlier about absorption, effectiveness, safety. Let's discuss price for a second. Each drop of the micellized product contains 600 international units. Bio-D-Mulsion Forte contains 2,000 international units per drop. That means that drop per drop, patients get about 330% more for their money. The vitamin D wars will continue, but in my opinion, absorption, safety, clinical experience, and cost make Bio-D-Mulsion Forte from Biotics Research Corporation the leading choice for vitamin D supplementation. Thanks for checking in, and I'll see you next Tuesday.